For a flexion lesion, again make sure that the patient's seated with their hands down by their side and their feet flat on the floor. Now in this case we'll know it's a flexion lesion because when we were doing the spinal assessment, the thumb would have gone up and down on the same side. So in other words, when they flexed forward it would have gone up, and when they extended the thumb would have come down. And whichever side that was, and in this case I'm going to use examples as if the thumb went up and down on the left side of the spine, then that means that the problem is on the left side of the spine. So wherever my dots are this time, it means that that particular vertebral segment has flexed and it's side bent and rotated to the left. So we've still got Freydt's law, non-neutral lesion, side bent and rotated to the same side. So I'm going to show you an example of how to do a flexion lesion at each area of the spine. So we'll start down here in the lumbar, and it's the same process in each area, but just the hand positioning alters slightly. So we stand on the side of the lesion this time, the side that my dot's on, the side that my thumb went up and down. And I put my finger on the dot, and I put my forearm of my other hand round the chest of the patient, and I then ask them to just extend over my finger. You sort of need them to cooperate a little bit here rather than doing it completely passively. And I take that to the point where I can feel it under my finger. I then side bend them away from me. In other words, I side bend them to the right because that's the way that it doesn't want to go, and I rotate to the right, again because it's the way it doesn't want to go. And I then ask them to push against my hand that's now on their shoulder back to the neutral position. And I keep that position there. It's not a hard push that they're giving until I feel the fizz stopping. So that's a flexion lesion in the lumbar area. That would be the same in the thoracics. When we get up to these upper thoracics, it's exactly the same again. We have, with the extension lesion, we land out having to adapt things slightly because of our hand, where we need to be able to put the hand for a push, but it doesn't change as much with the flexion lesion. I would use the head a little bit to try and get back to the point along with the shoulders, just to get into that, so we've got that extended at that point there. So I'm now choosing a point here, round about T3, where we've got it side bent and rotated to the left. On a flexion lesion, so I've extended it. I'm now going to side bend, so I'm just using the shoulders there, and rotate, just the same way as I did lower down. And again, my hand position hasn't changed here. It's again the shoulder that I use as the lever for them to push against me. We then move into the cervical, and it's the same idea again. So let's suppose that we've got my dot here, let's say, and what I will do is I will extend the cervical. I will then side bend it away from me. I will rotate that side bend to right. I will then rotate it right. Now here, rather than try and push their head here, it's easier to change the side and actually get them to push, putting my heel of my hand on their left side of their head, the forehead, and they just push against me that way. But it's the same angle of push as lower down. And again, I just hold that until it stops fizzing.